Hello, this is the recording to accompany the slides for the second out of two lectures on joints and the muscular system. My name is Dr. Alita Partasudarso, and I'll be walking you through these slides. So this slide gives you an overview of the material that we're going to cover today. So we're going to start off by going through just the naming system that people have used to give names to various muscles in the body. Then we're going to look at a few key joints and muscles of the axial skeleton, followed by a few key joints and muscles of the appendicular skeleton. So let's go. So you can see here, you can see two diagrams, one of the frontal view of a person and one of the back view of a person. I'm not expecting you to memorize any of the muscles here unless I refer to it in a subsequent slide. But just when you actually look at the names of the muscles, what you can see is that there is a system to it, right? So if a muscle has the prefix ad, it means that it's going towards, or if it has ab, it means it's going away from. And usually toward and away is towards the body and away from the body. Sub means under. Adductor means moving. So adductor means moving toward. Abductor means moving away. So, and then you've got anti, epi, apo, and then you've got longissimus and longus. Should be self-explanatory. Brevis, short. Maximus, large. Medium, medius, medium. Minimus, tiny or little. And then rectus means straight, right? And then multi, uni, bi, di, tri is refers to the number of insertion points, and quad as well. Externus refers to outside, and internus refers to inside. So, for example, if you have we have abdominal muscles. One set is called the internal obliques, and the other one is called the external obliques. So obliques means at an angle. Internal means it's on the inside. External means it's on the outside. Um, so you've got over here, you've got the external obliques, and then you've got rectus abdominis. Again, rectus means straight. Abdominis refers to the abdominal system, the abdominal area. So you know exactly from the name where it's located, right? For a lot of different muscles. Next, we're going to go and look at briefly some of the key muscles and joints within the axial skeleton. If you remember, the axial skeleton includes the bone that rotate around a central axis, so includes the bone of your skull and your face, includes the vertebrae, includes your thoracic cage. So when we look at this, the skeletal muscles, remember skeletal muscles are voluntarily controlled, and a lot of skeletal muscles are attached to a couple of bones, but the skeletal muscles on our face is attached to connective tissue and dermis and not bone. And that gives us our facial expression. It also allows us to open and shut our jaw, to move our jaw side to side, and all that kind of stuff. So when we look at some of the key muscles over here, again, just to break it down, orbicularis means around, right? So we have a muscle that's called orbicularis oculi. Oculi refers to eye. So the orbicularis oculi are these muscles that surround your eye. So it allows our eye to open and close. There is another orbicularis muscle, and the other orbicularis muscle is the one that's around our lips, right? So the one that's around our lips is called the orbicularis oris, and oris refers to oral. Oral refers to mouth. Another muscle is the occipitofrontalis. So again, that refers to the two bones that this muscle connects. So the occipitofrontalis muscle connects the occipital bone, which is just down under in the back bottom of your skull, with the frontal bone, which makes up your forehead. So you can see here, you've got this is the occipitofrontalis muscle. You've got the frontal belly, and then you've got the occipital belly, and in between, you've got a tendon that holds the frontal and the occipital belly together, and that tendon is called the epicranial aponeurosis. The next muscle is the buccinator, and that's the one that allows you to move your mouth, compresses the cheek, allows you to whistle, blow, suck, and chew. And then you've got the corrugator supercilii, and that's the muscles that are that move your eyebrows. So you can see over here in the green, this is the corrugator supercilii. Next set of muscles have to do with the jaw, so the temporomandibular joint. So again, it spans the temporal bone and the lower jaw, the mandible. So that's why it's called the temporomandibular joints. And you can see here the muscles that are involved in this TMJ are muscles that help you chew, bite, talk, whistle, and all that kind of stuff. So a few different muscles. One is the masseter here, and that basically elevates, lifts up the mandible to close your mouth. You've got the temporalis, which is located on top of the temporal bone. You've got the pterygoids, which are there's two sets of pterygoids. One is in the side, lateral pterygoid, and then the other one is in the towards the middle. That's the medial one. So you can see here, lateral on the outside, right towards the side, medial more towards the middle. And you can see here just the actions of those two muscles in opening, closing the mouth, moving the jaw from side to side, pushing the mandible out from under the maxilla. So I've got here just pictures from the previous lecture where you've got the different actions of the mandible: to elevate, depress, to retract, to move backwards, or to protract, to move forwards, right? So the motion of the mandible, the lower jaw, is contingent on these four sets of muscles working. When we move on next to the muscles of the anterior meaning in the front. So these are the muscles in the front of your neck. So what you can see here is you've got the hyoid bone over here. And remember, the hyoid bone is the only bone in the body that does not have a bone-to-bone connection. And so what you can see here is that the hyoid bone is held in place with the help of all these different muscles. So the muscles that are above the hyoid bone is called the suprahyoid muscle. Supra meaning above. The muscles that are below the hyoid bone is called the infrahyoid muscles. I'm not expecting you to remember the names of all these specific supra and infrahyoid bones. I just wanted you to know and to remember that the suprahyoid muscles are located above or superior to the hyoid bone. And you can see here when it contracts, you can imagine when it contracts over here, it makes these muscles shorter. And so then it raises the hyoid bone, it raises the floor of the mouth, and it raises the larynx during swallowing, during deglutition. The infrahyoid muscles are located below or inferior to the hyoid bone. And you can imagine that if these muscles contract, they become shorter. And so basically they move the hyoid bone down. And they also, together with the suprahyoid bone muscles, they work together to create different tones of voice. So they help us talk and project our voice and to give us the resonance, help to move our vocal muscles. Muscles that move the head. So as you know, the head is balanced on top of the vertebral column. Specifically, the occipital bone is perched on top of the C1 vertebrae. And so what happens is that we've got muscles on both sides of our neck, right? When these muscles contract unilaterally, so if the muscles on one side of the head contract, then the head rotates. So if the muscles on the left side of your neck contract, then your head rotates to the left. If the muscles on the right side of your head contract, then your head rotates to the right. When these muscles contract bilaterally, so both sides contract together, the head then flexes, moves forward, or extends, moves upright. The major muscle that you need to know in all this is the sternocleidomastoid muscle. So sterno refers to sternum, so your breastbone. Cleido refers to your clavicle, your collarbone, and it inserts into, as it says here, the mastoid process of your temporal bone. So by knowing the name of the muscle, you know exactly where it comes from. So it comes from the area of your sternum, your breastbone, and your collarbone, and goes all the way down to all the way up, to just below your ear, which is where the mastoid process of the temporal bone is located. Speaking of your head being located, being perched on top of your vertebral column, we're going to move next and look at articulations or joints of the vertebral column. So in general, what we have is we have zygapophyseal facet joints, and these are joints that connect one vertebrae to the vertebrae beneath it, and then there's another joint to connect it to the vertebrae above it. So if we take this random vertebrae over here, this random vertebrae over here, it's got a facet joint above, connecting it to the vertebrae above, and it's got another joint below, connecting it to the vertebrae below, right? And again, every time there's two vertebrae in contact with each other, then you've got one of these facet joints. These joints have got limited motion because they are a plane joint. The two special joints in the vertebral column are the atlanto-occipital joint, and atlanto refers to atlas, which is your first cervical vertebrae, and this is the atlanto-occipital joint. So you've got your first cervical vertebrae, C1, having a connection or a joint and articulation with the occipital bone of your skull over here. So that's called the atlanto-occipital joint. And when the muscles that connect the C1 to the occipital bone allows your head to nod in a yes motion, right? To flex and extend in a yes motion. The other special joint of the vertebral column is the atlanto-axial joint. So the atlanto-axial joint is between C1 and C2. And remember the dens? The dens is is a process that sticks out of C2 and basically stops your head from losing position. And the dens, together with the muscles involved in the vertebral column and the atlantoaxial joint, allows the atlas to rotate on top of the axis. So when the atlas spins, when you see one spins on top of the axis, then your head moves from right to left in a no motion, in a shaking your head motion. When we look at the muscles of the posterior neck, so the neck at the back and your back in general, what you can see here is you've got a bunch of different muscles. And the muscles vary not only in terms of length, so you've got some very short muscles, right? And you see here these very short muscles indicated in 4. Basically connect one process. So a process is a part of the bone that sticks out, connects the process of one vertebrae to the process of the vertebrae above and below, right? So these short muscles are collectively called the segmental muscle group in 4. And so you've got the intertransverse seri, and you've got the interspinalis. So I'm going to go over here and just to point out where the transverse process and the spinous process are located. So the transverse process are located at the side, and the spinous process are located at the back. So you can see, so this would be the spinous process. And so you would have the interspinalis muscles basically connecting one spinous process to the next. So another one would be there, and then another one would be there. There's also a muscle that connects one transverse process to the other. So when you look in the diagram in the middle, you've got the transverse process over here. So you have a short muscles connecting one transverse process to the one above and then another one to the one below, right? And these muscles basically help to keep the vertebrae stacked on top of each other and also allow us some degree of movement of our back and stabilizes the vertebral column. We've also got longer muscles. You see here the splenius muscles basically helps to extend and rotate the head and flex the head on the side. So if you basically move your head so that your ear moves towards your shoulder on one side and then to the other side, that's called lateral flexion. You've got the erector spinae group, which is in the blue over here. So you can see here that these are longer muscles, right? To keep the lumbar curve, to again lateral flexion, to extend. And then you've got the transversospinalis. So again, this refers to the processes. So the transversospinalis connects the spinous and the transverse processes of each of vertebrae. So basically, is the muscle runs at an angle. You've got the segmental muscle group that I talked to you about, and then you've got the scalene muscles here as well, right? So you can see just by the location what it actually does. When we move next to the muscles of the abdominal wall and thorax, this is where you've got 4 groups of muscles in the front and side of the abdominal area. So you've got the obliques. So the obliques run at an angle. So you can see over here, this is the external oblique. So you can see the external oblique run this way, and then the internal oblique run the opposite way. So the external oblique muscles are the most superficial muscles, and what I've got over here is I've just got some description so that you know which direction the muscles run. So if if you're wearing a pair of pants with pockets, if you slide wearing jeans, sorry, and then you slide the four fingers into the pants pocket, that's the direction of the external oblique. The internal oblique are the direction of the thumbs when the other fingers are in the pants pocket. Transversus abdominis. Transverse means straight. So you can see the transversus abdominis run straight from middle to the side, and then the rectus abdominal muscles run superior anterior, right? So you've got these four muscles, you've got the direction that it follows, and then you got what happens over here when those muscles are contracted, what action it actually leads to. So again, if you contract your external and internal obliques, then you can twist at the waist, you can bend to the side. If you contract your abdominis, your transverse abdominis, then it compresses. So that's you do that during forceful breathing, during defecation, urination, and childbirth. And then when you flex your rectus abdominis muscle, then you sit up. All right, and again, this is about as much detail as you need to know when you're actually studying this lecture. The last, sorry, not the last slide. So the second to last slide on the muscles of the axial skeleton are to do with muscles of the thorax, your rib cage. So the first muscle is your diaphragm. Right? What happens with your diaphragm is that at rest, it's a dome shape. And when it contracts, it becomes flatter. Right? So it goes from a dome shape when it's relaxed to a flatter shape when it's contracted. And so what happens is when the diaphragm contracts, the dome gets lowered, and then the chest cavity, your overall volume of air that can be contained in your chest cavity increases. Air enters into the lungs, and this is called inhalation. Right? So you see over here, this is the diaphragm when looking from the inferior side. Other muscles to do that help with breathing are the external, internal, and innermost intercostal muscles. So when you see this, you can work out the location, right? The external muscles, the external intercostal muscles are on the outside, the internal are on the inside, the innermost are deeper in than the internal intercostals. The word intercostal refers to the costal cartilage that attach the ribs to the sternum. So that's where the name comes from. So again, just by looking at the name, you know exactly where they're located in terms of how deep or superficial they are, and you know which where in the body they're located. So because it refers to costal, and inter means in between. So you can see here the intercostal muscles are in between subsequent adjacent ribs. So with the external intercostal muscles, when they contract, it causes the thoracic cavity to expand a little bit more, and so it allows more air to go in. Whereas when the internal intercostal muscles contract, then what happens is it decreases the size of the thoracic cavity, and so then it helps to breathe out or to exhale. And the innermost intercostal muscles are synergists, so they help the internal intercostals function. If you look at the diagram in the top right-hand corner, this is, as I said, the diagram of the diaphragm from an inferior view from the bottom. And so what you can see over here is that there are a few different openings in the diaphragm, which is normal. So the first opening is the caval opening, which allows the inferior vena cava to pass through. The second one is the esophageal hiatus that allows the esophagus to pass through. And then the third one is the aortic hiatus, which allows the aorta, thoracic duct, and azygous vein to pass through. But other than that, the diaphragm acts as a wall between the thoracic cage and the abdominal cavity, or the thoracic cavity and the abdominal cavity. So that's that's in the thorax, that's between the thoracic cavity and the abdominal cavity. When we move to the next next slide, this is further down below. So these are muscles of the floor and the perineum, right? So the floor also has, or the pelvic floor also has a diaphragm. And the pelvic floor diaphragm you can see here in both the male and the female. So it spans from the front to the back of the male and the female. It has a large levator ani. And again, if you look at the name levator ani, levitate, to bring up, ani refers to the anus. So again, just from the name, you know exactly where it's located. So this pelvic diagram helps to keep support the viscera, the internal organs in the pelvis, helps to create the external and internal, helps to create the external, which is made out of skeletal muscle, the external urethral and anal sphincters. So you can see here, this is the urethral opening here, right? And then the anus is over here, so that helps to create the sphincters, the external urethral and anal sphincters. And then when the abdominal muscles contract, it helps to resist pressure. And so the pelvic diaphragm actually keeps everything intact, stops the pelvic, the organs that are in the pelvic area from actually dropping out. And then the perineum, as it says here, diamond-shaped area between the pubic symphysis at the front. Remember, the pubic symphysis is a joint in the front of the pubic bones, and the coccyx, which is the tailbone, and then the ischial tuberosities on the side. And it's split into two triangles. So the triangle in the front is called the urogenital triangle right here. So the urogenital triangle in the front, and then in the back, you've got the anal triangle over here. And needless to say, the anus, the skeletal external anal sphincter, is found in the anal triangle. The urethra and the urethral sphincters is found in the urogenital triangle. All right, moving on to muscles and joints in the appendicular skeleton. So the first joint we're going to look at is the shoulder joint. It's also referred to as the glenohumeral joint because it connects the bone of the upper arm, the humerus, to the glenoid cavity of the scapula, right? So you can see here in the green, the glenoid cavity is very shallow. And what happens is you have a layer of fibrocartilage called the glenoid labrum, which deepens the glenoid cavity to make it a little bit more stable. What you can see here is you've got a lot of different ligaments. Again, no need to actually know or memorize the name of the different ligaments. So the ligaments are like duct tape, very strong tape to actually keep the joint together. You've got muscles and tendons. Again, the tendons connect the muscle to the bone, right? So where you have a muscle, you have a tendon connecting the muscle to the bone. And then you've got bursae. One of them is indicated in the diagram on the right, and you can see here the bursae here is called the subacromial bursae. Only reason I mention it is, again, the location of the bursae is indicated in the name. So sub means below. Acromium is the part of the clavicle. Oh, sorry, it's the part of the scapula that connects in with the clavicle, right? So you can see here, this um, the clavicular ligament connects the clavicle to the acromion of the shoulder blade. The next joints are the elbow and wrist joint. So the elbow connects the distal end, the far end of the humerus, with the proximal, the near end of the radius and ulna, your bones of the forearm, and that allows the forearm to flex and extend, allows the the radius to rotate as well. So the elbow joint is made out of the humeral ulnar joint. So the joint that connects the humerus to the ulna, the humeral radial joint connecting the humerus to the radius, and then the proximal radial ulnar joint, which connects the proximal part of the radius to the ulna over here. The wrist joint articulates between the distal end, the far end of the radius and ulna, together with the wrist bones, right? And this wrist joint connection allows the forearm to pronate, to like when you bounce a basketball, and to supinate when you put your palms face up. And then you've also got the distal radial ulnar joints here. So just as a reminder, the radius and ulna articulate with each other at 3 different points: at the proximal radial ulnar joint, at the distal radial ulnar joint, and then with the help of the interosseous membrane that span the entire length of the 2 bones. When we look at muscles that move the arm, you've got muscles that move the humerus anteriorly, that bring your arm up to the side. You've got muscles that move the humerus inferiorly, right, which are these muscles that move your arm to the back. And then you've got, that move your humerus down. And then you've got muscles that move the humerus posteriorly to the back, which are located in the posterior side of the body and insert into the shoulder blade. And then you've got a whole bunch of muscles that allow your forearm to flex, extend, pronate, and supinate as well. So for this, what I want you to do is I want you to be familiar with the different actions that your arm can do, right? I don't want you to memorize the names of the muscles that allow you to do it, but the different motions that your arm can do, and as well as the location of these various muscles that allow your arm to do everything that it can in the arms. Again, muscles that move the hand and the wrist. What I suggest you do for this is when you actually look at these 3 things, you can see that if you actually look at your hand, put your hand out and touch the muscles in the anterior compartment of your forearm, right? Anterior compartment of your forearm over here. And if you imagine those muscles contracting, then you know that when they become shorter, it allows your hand and fingers to flex. Similarly, you touch the posterior compartment of your forearm and you imagine those muscles contracting, becoming shorter, then you know that it extends your hands and fingers. We've also got intrinsic muscles of the hand within the hand that allow us to type, write, text, and all that kind of stuff. Move to the joints of the lower limbs. We start off with the hip joint. Again, the hip joint is another example of a ball and socket joint. The difference between the hip joint and the shoulder joint is the depth of that cavity, right? So in the shoulder joint, the glenoid cavity is very shallow. In the hip joint, the acetabulum of the hip bone is a lot deeper, and that deeper cavity in the hip joint restricts the range of motion, but also stabilizes it and strengthens it, right? Because your hip joint, you need your hip joint to be stable and steady in order for us to actually stand, walk, move, jump, right? Whereas your glenoid cavity of your shoulder joint should be shallow in order to allow your arms a wider range of motion. In the acetabulum, which is the socket, it's deep already, but we also have a layer of fibrocartilage to make it even deeper. Like the shoulder joint, there is a lot of strong ligaments that connect the hip joint. So you can see here in the green, those are all ligaments. And if you wanted to look at the names of the ligament, it actually shows you where it's located. So the iliofemoral ligament starts from the ilium of the hip bone to the femur. Pubofemoral ligament starts from the pubis to the femur, and all that kind of stuff, right? But you don't need to memorize it. Muscles of the thigh are bigger and more powerful than equivalent muscles in the upper limbs because, again, to support, stabilize the body, generate movement, maintain posture. And then muscles in the gluteal region in the butt that move the femur also help to stabilize the knee. So it allows the legs to move as well as to help to stabilize the knee joint. Which brings us to our next slide. So the knee joint is one of the most ill-fitting joints in the body. And it's made out of 3 different joints. So one connects the femur to the patella, the knee bone, and then the other 2 connects the femur to the tibia. So the tibia is the larger bone in the lower leg. The fibula is the bone that's on the outside, and it's a smaller bone. And what you can see over here is that the fibula does not articulate with either the femur, because the patella, because the patella is over here, and then the femur starts over here. So the fibula does not articulate with either the knee bone or the upper leg bone. It articulates proximally with only the tibia, the other bone of the lower leg, the bigger bone of the lower leg. You can see here in the knee joint there is meniscus, medial and lateral meniscus over here. And the meniscus you can see here is made out of fibrocartilage. It's C-shape, and it basically helps to reduce friction, to provide padding, with the knee, at the knee joints to prevent wear and tear. Remember that cartilage is avascular, so if the meniscus is damaged, it heals slowly and poorly. In the knee, because it's an ill-fitting joint, we also have a lot of different ligaments. So we've got ligaments in general, which are highlighted in green, and then we've got two specific ligaments that cross each other, and so that's why they're called cruciate, because cruciate refers to cross, right? And so you've got the posterior cruciate ligaments, the one in the back, and then the anterior cruciate ligament. So you can see that in the diagram on the right-hand side. You've got the posterior cruciate ligament and then the anterior cruciate ligament over there. So again, the ligaments are there to actually duct tape the bones of the knee joint together because it's not very, it doesn't fit very well. And then the ankle and foot joints, you can see the ankle joint is a connection between the talus bone and the distal ends of the tibia and fibula. It's a uniaxial joint, hinge joint, so it only moves in one plane. So it allows this dorsiflexion and plantar flexion. And then you've got the subtalar joint, which is between the talus and the calcaneus bone to allow the inversion and eversion movements. Again, note that we've got a lot of ligaments in the ankle and foot joints in order to stabilize that whole area so that we can run, jump, walk, skip, bounce around, and all that kind of stuff. And then lastly, we've got thigh muscles that move the lower limb. So with this, what I want you to do is know where your medial, anterior, posterior, and anterior. I think this should be lateral. Locations are and how they move. So if you look at the medial compartment of your thigh, imagine when you actually contract those muscles, what happens is that it will bring the femur to the middle, adduct the femur, and it also flexes the leg at the knee, right? And then the muscles in the lateral compartment flexes the thigh and extends the leg. Muscles in the posterior, in the back, will flex the leg, move your leg backwards and extend the thigh. And then muscles in the anterior compartment will raise the front of the foot. So again, no need to actually memorize the names of all these muscles. I just couldn't find a picture with no names because I want you to actually just, flex different and contract different parts of your thigh muscles to see what would happen in terms of movement, flexion, extension, raising, lowering, and all that kind of stuff. So I hope this is clear, and I'll see you soon.